Welcome to episode 5 of Dr Hatz vlog, Insights from a Clinician CEO. In this episode, we're going to be talking about NHS connectivity and technology. Last year, I chaired a conference from Convenzis on this topic. I learned so much that day. I learned that actually, when it comes to technology, if we procure relationships, we're more likely to be able to get the technology that works for the NHS. I also learned about all of the various things that are happening to improve connectivity in hospitals, for example, the usage of 5G and how impactful that can be. I saw a number of case studies where people have come together with industry and with academic partners to truly transform the NHS services through technology. So in this video, you'll see some of my reflections from that event, and at the end of the video, I'll summarise where I think we'll be going this year from a technology perspective. It's been a pleasure to be at the Convenzis second NHS Connectivity Conference. The reality is that as we move forward, we are looking towards less shifts in the NHS, and one of those shifts is from analogue to digital. But to do that well, we have to understand what legacy systems we have in place and think about what systems we need for the future. And today I've learned a lot, and I think bringing the right people in the room, hearing about kind of ways that we can tackle some of these issues, I've taken so much away from how we do relationships well when it comes to procurement. So it's not transactional, but really is working together collaboratively around issues with industry partners, all the way through to how we bring the workforce along on this journey, making sure that we create the time, the headspace, and that comes from a responsibility from providers of these technologies to be able to build that in place. And all of the wider challenges that we have, particularly as we look at new hospitals and other transformation in the NHS, to make sure that we have the right infrastructure and connectivity to be able to do technology well. For me, that has to be a two-staged approach. So really understanding what legacy technology that you have in place and which of those technologies are delivering value, but then to start to look to the future. And we have to be able to look 5-10 years ahead. So today we heard about artificial intelligence, we heard about data at scale, we heard about genomics, we heard about all of those wonderful things that are going to really transform patient care. So being able to take stock of what you already have, lift that, but while you lift that, make it future-proof at the same time. We had some wonderful speakers from the NHS, all the way from NHS England through to some of the trusts and teaching hospitals, and they talked about some of those immediate challenges, and particularly around some of the solutions already that we have. So frontline digitisation, the roles of electronic healthcare records, the work around virtual wards and remote monitoring. These things are already happening and are tackling some of the problems for today. And while we look at those problems, they also talked about what the future looks like. So really thinking about how we can embed these future technologies into what we're already doing, and making sure that we actually measure the right things and thinking downstream as well. I really enjoyed some of the conversation around not thinking about these things in our bubbles alone, but actually what is the impact on the wider integrated health and care system? What is the impact on just wider society as a whole? And really considering the impact on service users and patients too. Really going wider altogether in the outcomes that we look for when we're considering technology. So as we look ahead in 2025 to be able to move the NHS towards digital, we've got lots of opportunity. How can we enhance and empower ourselves through the implementation that's been done around electronic healthcare records? What more can we do through all the data now we have available to us, particularly in these secure data environments, where we've got the potential to accelerate research and innovation? And what uptake are we going to see when it comes to artificial intelligence to help make our lives easier in health and care, to make my job easier as a GP, so that we can concentrate on what's most important, the people that we care for. I hope you enjoyed the episode and look forward to seeing you again soon.